coming up, we'll be on location at DC Dental Sedation in Washington, D.C., discussing the benefits of sedation dentistry and how it can help you overcome the fear and anxiety of going to a dentist with one of this region's top dentists, Dr. Saba. Dr. Saba received his DMD degree from the University of Pittsburgh and is a member of the American Dental Society of Anesthesiology. Dr. Saba is widely recognized as one of this region's top sedation dentists. Welcome, Dr. Saba. It's a pleasure having you with us today.
Thank you. It's good to be here.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have a patient as well, from what I understand, that's going to be joining us in a little bit. But I wanted to begin, if I may, Doctor, by asking you if you can please tell us what sedation dentistry is.
Sedation dentistry, also known as sleep dentistry, is the use of medication to achieve a level of anesthesia that allows patients to go through dental procedures without anxiety and in a relaxed state.
And we all know that one of the biggest fears that people have is going to a dentist. But yet we have to go to a dentist, because if we don't, we get all sorts of problems and pain that results over time. So this is a great option for folks out there who need to go to a dentist, have too much anxiety or fear, and this allows them to get what needs to be done in a sedated, relaxed manner, if I'm not mistaken.
Precisely.
And what forms of sedation do you offer your patients?
We offer intravenous or IV sedation, which is ideal for most dental procedures. It's the most reliable form of administration because it allows you to control the level of sedation quite easily. Based on each patient's unique physiology and the level of stimulation, that level can be modified.
I wanted to follow that up, Dr. Saba, by asking you, from our research and what we've seen and heard out there in the dental community, there are a number of dentists that say they offer sedation dentistry, but from what I understand, most of them basically only offer the oral option for sedation dentistry, and you actually offer that. You actually offer something else. Can you please tell us the distinction, because you're one of the few in this region that does?
Sure. Now, a lot of dentists do offer oral sedation, which, it works on some patients. Patients that are extremely phobic, it doesn't work on. And again, if a procedure is very involved and you want to get several appointments into one, it may not work as well. Because it goes through your digestive system, it's difficult to control how much effect it will have. And on different patients, again, based on their physiology, it can have different effects. With IV, because it goes directly into the bloodstream, it's very easy to control that level and make sure that patient is in a comfortable and safe state.
And that's a huge benefit that obviously separates how you perform sedation dentistry to the patient's benefit as opposed to the oral option.
Correct.
And what dental procedures or treatments would you say are best performed on patients under sedation?
Well, really any procedure can be done under sedation. However, it's usually used for lengthier treatments and ones that are more involved. Some of the examples are complicated extractions, any type of surgery, really, implant placement, root canals, gum surgery, things of that nature.
And what would you say are some of the major benefits of sedation dentistry?
Patients usually have no memory of it once the treatment is completed. Because of that, it's ideal for the phobic population who would otherwise not seek dental care. Other benefits of it is you can combine several appointments into one. You can have a 3-hour session where if you're not sedated, you're not going to sit through a 3-hour session or 4-hour session. That way, for busy individuals who want to get several appointments done at one sitting, they're able to do so.
That's a great benefit, especially in this area where there's so many busy professionals.
Absolutely.
And instead of having to come multiple times over a couple of months, they get it all done in one sitting without any fear or anxiety.
Absolutely. You miss one day of work and you take that day off and you get everything done in one day. Of course, it's also very beneficial for people with certain medical conditions or disabilities as well.
Yes. speaking of that, who would you say would be a good candidate for sedation dentistry?
Anyone really that wants to combine several appointments into one. Individuals who are afraid of going to the dentist. You know, if they're afraid of the sights, the smells, the sounds associated with dentistry. Individuals that have a hard time getting numb, or perhaps have sensitive teeth, or have a strong gag reflex. These individuals are all great candidates. And of course, you know, patients with certain medical conditions or disabilities are absolutely in need of sedation.
That's a lot of folks out there you just covered that can benefit from sedation dentistry. We're now going to meet a patient of Dr. Saba in DC Dental Sedation. Welcome, Patrick. It's a pleasure having you with us.
Thank you so much. Thank you for having me.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Patrick, by asking you if you can please tell us what brought you to Dr. Saba.
Absolutely. Well, I have a lot of anxiety when it comes to going to the dentist.
Like many folks.
Like many people. Even just the thought of scheduling an appointment would make me nervous. I would get butterflies in my stomach. So I'd always delay the fact of making the appointment that I knew I had to do. Even when I had pain, I would take pain medication just to avoid going to the dentist. It got so bad, it got to a point where the pain was unbearable and I had to make an appointment, emergency appointment. And I went to my dentist and he said I needed a root canal. I got so nervous and the anxiety set in, I felt like I was going to pass out, so I had to stop my dentist. That's when he suggested that I contact Dr. Saba, and that's how I met him. Oh,
okay, so then you met Dr. Saba, and then obviously you were sedated, and then you got the necessary treatment or treatments that you needed.
Yes, I had a lot of problems with my mouth. I had several broken down teeth, the root canal that I mentioned, and I needed a couple of extractions. And my doctor said that my dentist said it was going to take several appointments through a lot of procedures to get them all done. So it created a lot of anxiety for me.
Yes, yes indeed. No, that's a very common problem, as we mentioned a moment ago. And then so you had these treatments done, because see, that's what folks out there like yourself, and there's numerous people who have a huge fear of going to a dentist, and they don't realize that by not going to a dentist as a result, like you hadn't, we create all these problems that start surfacing in our mouth and with our teeth, to the point where in your case you start getting so much pain that you have no choice but to come to a dentist. So sedation dentistry was the perfect option for you.
Well, and having discussed it with his office and his staff, and the possibility of having it all done in one session was introduced to me, and that definitely got my attention.
Yes, instead of coming, like the other dentist said, over many visits over a period of time. I mean, you're a busy professional, and like many others in this region, and this way you come in, you get sedated, you get any and all work you need done, you leave, and then you're good to go for some time.
Absolutely.
And I wanted to ask you, Patrick, also, what would you tell the folks out there watching right now about your experience not only with Dr. Saba, but the staff here at DC Dental Sedation?
Oh, they were phenomenal. I started out with a text message, texting them, and they got back to me right away. They were very knowledgeable. I had a phone consultation with Dr. Saba, which put me at ease before I even got a chance to meet him. As a matter of fact, I'm having gum surgery done in a little while, and I'm definitely going to be reaching out to Dr. Saba's office.
Yes, indeed. And lastly, before I let you go, for all the folks out there, any final thoughts for our viewers?
If anybody is nervous or has anxiety built up before they call a dentist, don't delay it. Call Dr. Saba, call your dentist, make it work out, and you won't regret it.
Well, on that note, we'd like to thank you, Patrick, for coming down and joining us and being a guest on our program.
Absolutely. Thank you for having me.
It's our pleasure. We're now back with Dr. Saba. I must say, Patrick is very pleased with the results. Obviously, he's a typical anxiety phobic patient as far as when it comes to going to a dentist, but he got the work needed, got the pain taken care of as a result of the dental treatments, and he really spoke very highly of you and your staff here at DC Dental Sedation.
That's great to hear.
Now, are there any age restrictions for using sedation, or can quite a few folks covering a lot of range and age benefit from this?
So there's really no age restriction. However, a thorough medical history will be collected and reviewed to ensure patient safety before going through the procedure.
How long does a sedation normally last? Now, I throw in the disclaimer that I'm sure it varies based on how much work is being done on each patient and how long we're talking about, but in general, what are we looking at after a patient leaves to when the sedation effect fully removes itself from us?
Depends on each individual and how quickly they metabolize the medication. But normally, because again, the medication is administered through IV, it's easy to control the level, and knowing when the procedure's ending, they will get lighter towards the end. And of course, when the procedure's over, most patients are able to walk on their own. However, they will be sleepy, and that's why we ask them to take it easy on the day of their appointment.
Yes, no, that makes perfect sense. And how safe is sedation dentistry, Dr. Saba?
Sedation dentistry is both effective and safe if administered by a trained professional. To ensure patient safety, a thorough health history is collected and reviewed prior to the appointment. There's certain medications and certain medical conditions that may preclude the patients from receiving certain medications. So again, the health history is key. I offer a complimentary phone consultation, so you can have all your questions answered before you decide whether sedation is right for you or your child.
Now, we're literally out of time, Dr. Saba, but I wanted to ask you before I let you go, you and your practice, DC Dental Sedation, have established a reputation for excellence in not only patient care, but in treatments that you offer, but at the same time, you're one of this region's top and only sedation dentists. There are very few sedation dentists, and you're certainly recognized as one of the best. And I just wanted to ask you what you feel really separates you and your practice apart from many others?
Well, it all starts with the patient. You know, you do what's right for the patient, everything else falls into place. As clinicians, we have to ask ourselves, before doing anything, is it in the patient's best interest? And honestly, once you do that, everything else follows. Our goal at DC Dental Sedation is to provide a safe, anxiety-free, and relaxing environment when in the dental chair. Because we offer our services at any dental practice in the Northern Virginia and DC area, we're able to offer a service to a wider range of patients that need the sedation. As a big advocate of continuing education, I keep current with advances in sedation techniques, equipment, and medications, and you only use armamentarium that is proven to be of high caliber and most accepted by patients.
Yes, indeed, not to mention that you just touched on a few moments ago that you're mobile as far as covering the area where you can help patients who have that anxiety, that fear, because you're one of this region's top sedation dentists. That's a great benefit to help a lot of folks, Doctor.
It is, thank you.
And on that note, I'd like to thank you for joining us, being a guest in our program. It was our pleasure, and we'd love to have you back on in the future.
Thank you for having me.